Hi, I'm just Paddy B,
Baron.
and today we're here to talk about US healthcare. This is the second part of our three-part series. If you would like to leave a comment, please give us a like and please subscribe. That would be amazing. Thank you. I'm going to pass on to Faroon as our resident expert.
Well, hello. Today I'd like to talk a little bit about the U.S. healthcare system. It's quite vast, quite confusing, even to Americans. So today we'd like to go over a little bit about what makes it different from the UK system, and why is it the way it is.
Well,
First
the
up,
main points would be that it's not socialized
exactly. So
automatically.
it's not socialized. It's a more of a capitalist, privatized system.
Mhm.
Um, and there are two major categories that you could put the U.S. healthcare system in: public, government funded, and then private. So going into the government slash public funded, we could talk about the different systems you have. And for reference, make sure I get this right. You got the Medicare, which is primarily medical coverage for people over 65. And then you have the Medicaid, which is designed for people with limited income, um, like the lower portions
So it's
of
not designed
society.
for people who have long-term illnesses. It's literally designed for low income families or
Right. So
people.
the Medicaid, the first one, or the Medicare, the first one covers age 65 and disabilities. And I'm
So does it only cover 65 with a disability, or is it
both.
both?
So 65 or older
So
plus.
what disability would qualify you?
Oh, like,
Just think of a
okay,
disability.
so disabilities. An amputation,
Okay.
perhaps born with the Down syndrome disability,
Are
autism.
there areas where America doesn't recognize certain disabilities and you can't qualify, which is a hot button topic, or is it just
No, there. Well, provided that the provider that you've seen has classified your illness or
as a disability?
as a
Okay.
disability, then bam, you're a disability. Like
Okay, cool. So there's
I've even
no.
heard some off the wall ones. Like somebody had contacted somebody with TB, tuberculosis,
Ooh,
and that person was categorized as a disabled person because he had contact with somebody else, even though he had no
okay.
symptoms. So it's a
So
little.
so there's no government intervention of them making a list and going, right, you have to be one of these and
Yeah,
you're
there's a
in
list.
it.
There's always a list.
But the list is medically owned and
Right, it's
used,
medically owned.
not
Yeah,
not
yeah,
not okay. Well, that's not bad.
yeah,
It's annoying, but it's not
yeah.
bad. So
So I mean,
continue.
they're going to be taken care of regardless.
Yeah.
It's just how much are they going to be taken care of, and that's kind of goes into the final aspect of the Medicaid, Medicare, which is how much are they going to help you. And that's based on how your needs. So the more you need, the more they'll help. If you only need a little bit of help, they'll only give you a little bit.
So they'll
Because
put a band-aid on it
they
instead of properly
they do
fixing it.
because they also have another health system that's outside of the healthcare system that kind of coincides with the Medicare or Medicaid, which is the healthcare system or the welfare system, which
Okay.
helps provide for food, housing, et cetera, et cetera. So that kind of goes into that. It helps you out on that side of the house as well. um, so and then private, going
Mhm.
straight into private. Private now are for individuals who have
Money.
healthcare. True money. The money and the patience and the ability to get in the hospital to get seen when they want.
Hmm.
So if you got money, you can do anything in this world, and that goes with healthcare in the states as well.
Yeah.
So um, if you're in the age group of 18 to 65 or 64 and a half, 65, just at the cutoff for Medicaid,
Hmm.
then you have to either get health insurance through your employer on your own. Um, but Obama tried to fix that a couple years ago by providing Americans something called Obamacare
Yep.
or the Affordable Health Care Act,
Yep.
which pretty much said every household, to include children over the age of 18 that are living at home, have to have private or this healthcare insurance.
Yep.
Basically, it was based on a certain uh, income level per family per year. And if you aren't covered under that program and you do not have health insurance, you get fined in your taxes every year. $325 or I think it's $162.75.
Would that equate to how much it would cost for the insurance in the first place?
No, it's a fee. So if you don't have the insurance, because the insurance
No, no,
costs
no.
more than
That's
that.
not what I mean. I mean, does the fine basically go? Well, if you're not going to pay for insurance and get insurance, we're just going to fine you for what they would cost anyway. So you just get the damn insurance.
No, because the insurance is actually more than what the fine
Okay.
is.
Well,
So you get fined at the end of the year for your taxes if you don't
so
have
if
insurance.
even then, if you still don't have the money and you just take the fine and just take the
You take
hit,
the fine and you take the no insurance and you try to go when you try to wing it. You try to wing it,
which is the only option
yeah,
you really
it's
have.
the only option you really have. So if you don't have health care and you're in the 18 to 64 and a half ish age, you don't have health care, don't get sick. Is it too costly? It really is too costly to go to an 80 or to go
Well,
to ER as they call it in
This
the
is
States.
kind of the perfect example right now. We all know what's going on right now. There's a massive public crisis going on worldwide. We know what's happening in America. And I was watching, obviously, Mr. Beast, who likes to give away tons of money, which is just amazing. But he basically rang up some people who were out of work and stuff, and the guy was saying in that video that he had 15K for his treatment of the global bastard, if you want to call it that, and basically it got froze because the local government there decided that they would freeze all payments to the hospital for that illness, but they don't know what they're doing with it. He doesn't know if he's going to have to pay that after the fact. Like, he doesn't know if all this is done, you'll still have to pay it. But 15K to be treated is just astronomical.
Well, I can recall just in the news here in the UK, the couple, I think it was a couple months ago, a little bit longer than that now. A famous footballer had gone to the States and he had sprained his ankle or something like that, and he had gone to the hospital and he actually got a bill on the way out.
Yep.
And he was surprised. He was like, "What is this?" And it was not a couple $100. It was not a couple $1,000. It was tens of thousands of dollars for,
because
for
they
his
knew,
treatment.
but they also knew he could pay for it as well.
Yeah.
So they're going to completely abuse it and say,
Yeah.
go charge him $3,000 for a cotton swab.
Yeah. Well, I mean, just going, if we're going to touch the costs, I like to just talk about the prescription costs for one, which, you know, I don't know any person that would willingly pay out a couple $100 for a pill, a bottle of pills for 30 pills, a couple $100 for that.
It depends what they do. Just to be clear about it,
things
it depends
like
what they do.
I mean, they're charging the elderly and the disabled and folks like me, I suppose, the little older folks that need medication daily. They're not giving us discounts for that. They're having us pay full non-generic,
regardless if you're on Medicare or Medicaid, you're still paying
regardless.
Full prescription fee.
Full prescription fees.
For example, how much is an inhaler in America?
Oh, I don't know the latest fees. I could look it up.
No, but how much from your experience of
$95.
$95. So we can just assume with inflation that's gone up from the last time you know that.
Yep, yep.
$95 for an inhaler that is there to save someone's life when they're having an asthma attack.
Well, something as simple as paracetamol, which the equivalent in the States is acetaminophen or Tylenol. A bottle of that would cost you about $7 to $8.
How many pills?
30 pills.
It's similar-ish, but again, it's still.
I mean, yeah. I mean, you go down to the local.
You're better buying paracetamol on an off shelf than you are getting prescribed it.
Oh.
You'll pay more
here.
You'll pay more here.
You'll pay £8.50, whatever it is, for the prescription.
Yeah, but you'll pay more for the prescription for paracetamol when you can just go to an off-brand and get the same pill.
For what, 39 pence for a pack of?
Pretty much. I mean,
18.
Yeah, pretty much.
The
only problem is you have a limitation. You can only buy 1 or 2 packets, depending on which store you go to.
Who's eating that much paracetamol anyway, Patty?
Even if you are eating that much paracetamol, what's the risk? How many paracetamol would you have to take for it to be life-threatening?
If you took 30 paracetamol at once, you're going to damage your liver.
Oh yeah, you'll damage something. You won't kill yourself. Not automatically.
You'll be sick. You'll be very ill. Very ill. Yeah.
No, well, I mean, you'd be very ill if you eat too much of anything, really.
Well, yeah, true. So going back to the cost real quick, and I want to address this one thing, which I think is really important, is each hospital has a charge master that is based on location. There are 4 hospitals within where my son lives in Washington State, in proximity to him. Each one of those hospitals will charge me something different time I go to each one of those hospitals. So if I get an X-ray at Hospital A for $100, and I'm like, oh, you know, I don't like this provider. I'm gonna go to the Hospital B because I want to see that specialist over here. Well, I see the specialist over at Hospital B. I'm gonna get charged whatever the charge master at that hospital is going to charge for those services. So that
why is it different?
That's the age. I don't know. The charge master in each hospital is different based on insurance costs for the hospital.
Basically, the owner of
providers.
The hospital.
Yeah, the providers of the providers that they hire on, the specialists that they have. So if you go to a specialist, do I have to? I'd rather not. Yeah, going to that specialist who's like the only arrow taker out of my chest person in Washington, the only person that can do that, then I'm going to pay whatever he charges.
Yeah.
And the facility that I go to will charge me whatever they want for their cotton swabs or bed charges. If I have to go inpatient in the States, I'm looking at about $12,000 to $13,000 a night to stay there. And part of that can be covered under insurance, not all of it.
Yeah, because you've got the whole copay system.
Yep, the copay system. So I'll end up having to pay something up front, at the end, up front, and then the
best way of doing that is give an example of your own personal experiences, the whole copay stuff.
Oh, well, I mean, my son had to go to the hospital, and I'm not going to go into too much of what was going on, but we went to a specialist. We went to a specialist. He went in for an in-hospital stay for a week. I had to pay $600 some up front before he can even walk in the door. He got the treatment, and on the way out, I got a bill for the remainder.
Yep.
And I can't afford $10,000 to $12,000 for that week stay.
So obviously there was a copay where your insurance paid.
My copay is I had to pay $600 up front. That was my copay.
Well, what did you have to pay after the bill when you left?
Oh, that $12,000? I haven't got reconciled from the insurance company yet.
Oh, so you're still in the air. You're still waiting for how much they're going to pay.
I could still pay that.
So even if you have private insurance, you do not know, you're still going to have to pay something. You're not going to be completely covered.
Yep.
So even if you're, to use a full term of rich as fuck, you're still going to have to pay something when you go in because your insurance that you've paid for isn't going to cover everything.
Right.
So the only realistic job that you can have in America is someone who covers everything. And those are very few and far between.
Yep.
Like you're talking probably sports athletes at that point.
And the other part of it too is when politics gets involved with health insurance, it makes it even worse. Because I'm sure you've heard of the issue where employers were denying healthcare coverage for basic services like birth control for women
because
based on their religious standing. They were like, the
whole religious thing in America is ridiculous. That's a completely different discussion. But
that still affects our healthcare system in the end, because now we have outside influences the care that you get, whether it be something as simple as birth control for your family, or for an X-ray or a sprained ankle, splint or whatever. Okay, so the other part of it is real quick is HMOs and PPOs. Basically, HMOs is they call it a network. So let's say Hospital A is in this network, and your providers that you picked are in this HMO. Well, this HMO can't provide everything you need. They have to go over to this HMO across the way. The costs incurred, you'll have to pay for that referral out. And you'll have to pay whatever services that Hospital B will now charge you for that same thing. Wow. Not because your insurance is like, okay, we'll cover the in-network costs for the HMO here at this location, but now that you're going over to HMO at this location, we're gonna charge you the out-network costs. So I don't know. Overall, it's a more expensive system. If you have the money, you can get the treatment. There's a high level care, just like I said, if you can afford it. So that kind of wraps up the U.S. healthcare. I'm sure there's more things we could talk about with healthcare. We can go on for hours, but that's just kind of a brief overview. If you liked the video, give us a like. If you have any comments, anything you want to add to the conversation or questions for us, go ahead and write down in the comment section below.
I think just before we end the video, I would like to point out that if you want to understand more about how capitalist the actual healthcare in America is, there's a perfect movie called John Q, where he had healthcare that should have covered his son's heart surgery, but he found out that the company changed it and he was no longer covered. It stars Denzel Washington, and it's a perfect movie that basically describes a lot of the systems in place where it came to the company deciding. So that's what I would recommend if you want to understand more about that side of it.
And we'll actually put a link down in the description below for that as well. So if you want to take a look at that.
Yeah. Okay. Thanks for watching.
All right. Thanks.